Welcome back. This is part 61 of things that your vet staff wishes you knew, and for this video we are still covering blood work. This is part 2 of blood work, and if you have not watched part 1, I do recommend you go back to watch that now because I'm going to build off of each one. We're going to start this video by talking about white blood cells. White blood cells are part of the immune system, so they help us understand how your pet's body is responding to things like infection, inflammation, stress, allergies, and diseases. A high white blood cell count does not automatically mean infection. It doesn't tell us exactly what the problem is, but it does tell us the body is responding to something. There are different types of white blood cells, and each of those values can give us more clues as to what is actually going on. And in this video, I'm going to cover neutrophils, bands, lymphocytes, monocytes, eosinophils, and basophils. The first white blood cell value we're going to look at is actually total white blood cell count, and that is exactly what it sounds like. It is the sum of all the different types of white blood cells. If this value is high, it could mean infection, inflammation, stress, steroid response, immune stimulation, and sometimes cancer, but that is less common. If this value is low, it could mean severe or overwhelming infection, bone marrow suppression, viral disease, and some toxins and medications. Neutrophils are the body's first responders, so a high neutrophil value could mean bacterial infection, inflammation, tissue damage, abscesses, pancreatitis, pneumonia, or even pyometra. Low neutrophils are going to look relatively similar to a low total white blood cell count, so severe overwhelming infection, bone marrow issues, and certain viruses and toxins. Bands are immature neutrophils, and they mean that the body is fighting something hard to the point that the bone marrow is releasing them early. And bands are not always going to be shown on a typical blood panel. Sometimes that actually takes a pathologist looking at a slide of the blood to identify them. Lymphocytes are typically seen for long-term immune response, so a high value here could mean immune stimulation, chronic disease, and some cancers, and a low value could mean physiologic stress, steroid response, and illness. Monocytes are more of a cleanup crew, so a high value could mean chronic inflammation, ongoing disease, tissue damage, and physiologic stress, and a low value is usually not clinically significant, especially if all the other values are normal. Eosinophils are specialized white blood cells that respond to parasites and allergic reactions, so a high value could mean fleas, intestinal parasites, environmental and food allergies, sometimes asthma in cats, and certain inflammatory diseases. A low value, just like monocytes, is not clinically significant. Basophils are rarely emphasized and play more of a supporting role to eosinophils in allergic reactions and inflammatory responses. So a high value could mean allergies, parasitic infection, or chronic inflammation, and a low value is, again, not clinically significant. And I'm out of time, so I'll see you in the next one. Let me know if you have any questions or suggestions. Love you guys, bye. Welcome back. This is part 62 of things that your vet staff wishes you knew, and we are still covering blood work right now. This is part 3 of blood work, and if you have not watched parts 1 and 2, I do recommend you go back to watch those because I am just building off of each one. Someone wanted out of her enclosure, so at least for a little bit, we have a little guest star. This is Littlefoot. Full transparency, I am not exactly sure how many parts it is going to take to cover everything that I want to on blood work, and the crazy part is I am still barely scratching the surface, so just bear with me here, please. We're going to kickstart this video by talking about kidney values. One of the kidney values that we look at is BUN, or blood urea nitrogen. Urea is a waste product from protein breakdown that is made in the liver and filtered by the kidneys. It can tell us hydration status as well as how well the kidneys are removing waste. A high BUN could mean kidney disease, dehydration, GI bleeding, or high protein breakdown, and although it's less common, a low value could mean severe liver disease or low protein states. Another kidney value we look at is CREA, or creatinine. It is waste from muscle metabolism and is more specific to kidney function than BUN. A high value could mean kidney disease or dehydration, and a low value could mean low muscle mass, but it's not usually super concerning. And the last kidney value I'm going to talk about for this video is SDMA, which stands for symmetric dimethylarginine. It is a newer kidney marker that can detect kidney disease earlier than creatinine. It's a waste product from normal protein metabolism that is released into the bloodstream and should be almost entirely filtered out by the kidneys. This value is able to detect kidney disease earlier because creatinine doesn't increase until about 75% of kidney function is lost. while SDMA can increase when only 25 to 40% of kidney function is lost. SDMA is also more reliable than creatinine because creatinine can be affected by things like body condition and muscle mass, while SDMA is not significantly affected by muscle mass. I'm already past 2 minutes, so I don't feel like I have enough time to reliably cover another part of blood work right now. So the next video is going to cover liver values, and we'll get to that, but since I have just a little bit of extra time, here's a little fun fact about bearded dragons. They actually have a third eye on the top of their head that is covered by skin, and it is used purely for shadow detection. So that's it for part 3 of blood work, and I guess I'll see you guys in the next one, but let me know if you have any questions or suggestions. Love you guys, bye. Welcome back. This is part 63 of things that your vet staff wishes you knew, and we are still covering blood work. This will be part 4 of blood work, and if you have not watched the other 3 parts, I do recommend you go back to watch those. I am just building off of each video. We're going to start this video by talking about liver values. One of the liver values that we look at is called ALT, or alanine aminotransferase. ALT is an enzyme inside liver cells indicating liver cell damage, not necessarily meaning loss in liver function or liver disease, although it can also be elevated in those as well. An elevated ALT can mean liver inflammation, toxins in some medications, infection, or trauma. Another liver value we look at is ALP, which is alkaline phosphate. ALP is an enzyme associated with the bile ducts that can give us more information about the bile flow, liver stress, or hormonal influence. An elevated ALP could mean liver disease, could mean bile duct issues, steroids, which is common in dogs, Cushing's disease, or even normal growth in puppies. Another value we might look at is AST, which stands for aspartate aminotransferase. AST is an enzyme found in the liver and muscle, as well as small amounts in other tissues as well. AST is similar to ALT, but it's less specific to the liver than ALT is. An elevated AST could be coming from liver or muscle. And so liver causes would include hepatitis, toxins, and liver inflammation, and muscle causes would include injury or trauma, heavy exercise, seizures, or even injections. If we see an elevated AST, we're going to look to some of the other values to give us more context. So if it is paired with elevated ALT and other liver values, then we're going to lean more towards a liver cause. But if all of those values are normal, we might lean more towards a muscle cause. And the last liver value I'm going to cover for this video is bilirubin. And bilirubin is a yellow pigment produced when old red blood cells break down. When bilirubin is high, you are likely going to see jaundice, which would be a yellow color of the gums, the skin, or the eyes. Bilirubin is an important value to look at because it connects 3 major things: red blood cells, the liver, and the bile ducts. So when it's elevated, the problem could be any one of those. If it's pre-hepatic, before the liver, that means too many red blood cells are being destroyed for the liver to keep up. This could be seen in immune-mediated hemolytic anemia, or some infections. If it's hepatic, it is in the liver, so the liver can't process bilirubin properly, and you could see this in liver disease, hepatitis, toxins, and chronic liver damage. Post-hepatic would be after the liver, meaning that the bile can't flow out, and this could be seen in gallbladder issues, bile duct obstructions, and pancreatitis sometimes. And I'm out of time, so let me know if you have any questions or suggestions. Love you guys, bye. Welcome back. This is part 64 of things that your vet staff wishes you knew, and we are still covering blood work right now. This is part 5 of blood work, and if you have not watched the previous 4 parts, I do recommend you go back to watch those now because I'm building off of each one. We're going to start off this video by talking about electrolytes, specifically sodium and potassium for this video. Electrolytes are charged minerals in the blood that help regulate things like hydration, nerve function, involuntary and voluntary muscle contractions, and acid-base balance. Let's talk about sodium first. Sodium works closely with the kidneys to control water balance and maintain fluid balance inside the cells. So a high sodium usually means not enough water, and a low sodium usually means too much water or loss of sodium. Sodium is the main driver of cell tonicity, primarily due to the fact that water follows sodium. And you might be asking, what does that mean? And to that, I'm going to bring out this bad boy diagram that you probably saw something similar to in your high school biology class. Tonicity is referring to the water movement inside of cells. So if it's isotonic, it's stable. If it's hypotonic, the cell swells up, And if it's hypertonic, the cell shrinks. High sodium is called hypernatremia. It is when the blood is more concentrated or hypertonic. And low sodium is called hyponatremia. It is when the blood is more diluted or hypotonic. High sodium can be caused by dehydration or not drinking enough, or it can be caused by excessive water loss, such as in things like vomiting, diarrhea, or lots of heat. Low sodium can be caused by Addison's disease, kidney disease, fluid overload, or GI losses such as in vomiting and diarrhea. Now let's talk about potassium. Potassium controls muscle contractions, is critical for heart rhythm, and affects nerve signals. Even small changes in potassium can produce big effects. There's actually a really small reference range, even in humans. High potassium is called hyperkalemia, and when it happens, the cells become less excitable and heart conduction slows. It can cause bradycardia, arrhythmias, or even cardiac arrest. It can be caused by urinary obstructions because they can't excrete the potassium, kidney failure because they're not filtering the potassium, or Addison's disease where a hormonal imbalance is causing potassium retention. Low potassium is called hypokalemia, and it is when the cells become overly excitable but weak, and muscles don't function properly. It can cause weakness, muscle tremors, and lethargy, and can be caused by vomiting and diarrhea, chronic kidney disease, or poor intake. I'll make one more quick point before I wrap this video up. So we don't always look at these values individually. We will look at patterns between them. So for example, Addison's disease causes low sodium but high potassium. It affects both of those. That's all I have time for, so let me know if you have any questions or suggestions on what else you want me to cover. Love you guys, bye. Welcome back. This is part 65 of things that your vet staff wishes you knew, and we are still covering blood work right now. This is part 6 of blood work, and if you've not watched the previous 5 videos, I do recommend you go watch those because I am building off of each one. In the last video, we started talking about electrolytes, and I covered sodium and potassium. We are going to continue covering electrolytes and hopefully finish them up in this video. Let's talk about chloride first. Chloride levels generally fluctuate in tandem with sodium, and they work together to maintain fluid balance, blood pressure, and acid-base balance. But chloride can also act independently during specific acid-base imbalances. A high chloride value is called hyperchloremia, and it can be caused by things like dehydration, metabolic acidosis, and kidney disease. And signs of it would include lethargy, weakness, and sometimes increased breathing from acidosis. A low chloride value is called hypochloremia. It can be caused by things like vomiting because they're losing the stomach acid, metabolic alkalosis, and fluid overload. Signs of this can include weakness, lethargy, and sometimes GI signs, but vomiting history is important here. The next electrolyte we're going to talk about is calcium. Calcium is important for bone and teeth structure, nerve transmission, muscle contractions, and blood clotting. A high calcium value is called hypercalcemia. It can be caused by kidney disease, hyperparathyroidism, and cancer. That is a big one here. Signs of high calcium levels can look like increased thirst and urination, weakness, decreased appetite, and it can cause arrhythmias. A low calcium value is called hypocalcemia. It can be caused by low albumin, eclampsia, especially in small dogs, pancreatitis, and kidney disease. Signs of it would include muscle tremors, twitching, severe seizures, and restlessness. The next electrolyte that we're going to talk about is phosphorus, and phosphorus is essential for building strong bones and teeth, producing energy in the form of ATP, and supporting cellular repair, nerve conduction, and muscle function. It works alongside calcium to maintain metabolic balance, with the kidneys filtering excess amounts to prevent buildup. A high phosphate value is called hyperphosphatemia. Causes can include normal growth in animals, severe tissue damage, or kidney disease, which is often the most common. And signs are often subtle. They can look like weakness and can contribute to bone and mineral imbalances over time. A low phosphate value is called hypophosphatemia, and causes can include poor nutrition, refeeding syndrome, and insulin shifts, such as after treating diabetic ketoacidosis. Signs can include weakness, lethargy, and muscle breakdown in severe cases. And I'm out of time, so we will cover magnesium as the last electrolyte in the next video. Let me know if you have any questions or suggestions. Love you guys, bye. Welcome back. This is part 66 of things that your vet staff wishes you knew, and we are still covering blood work, believe it or not. This is part 7 of blood work, and if you have not watched the previous 6 parts, I recommend you go do that because I am building off of each video. As promised in the last video, we're going to start by finishing up electrolytes with the last one that I plan to cover, and that is magnesium. Magnesium acts as a vital mineral for over 300 biochemical reactions, including muscle contraction, nerve function, bone health, and energy production. It helps keep heartbeats steady and supports potassium. It basically helps the body hold on to potassium instead of getting wasted and lost through the kidneys. You can give potassium supplements all day long, but they won't help unless the magnesium levels are also good. A high magnesium level is called hypermagnesemia, and causes can include kidney disease or excess supplementation. Signs would include lethargy, weak reflexes, bradycardia, and in severe cases, cardiac issues. A low magnesium value would be called hypomagnesemia, and causes would include GI losses, such as in vomiting and diarrhea, poor intake, and certain endocrine disorders. Signs include muscle tremors, weakness, and arrhythmias. And now that we're finally moving away from electrolytes, the next blood value I want to cover is glucose. Glucose is blood sugar, and it is the main energy source for the body. A high glucose is called hyperglycemia. Causes include diabetes mellitus, which is a really big one here, stress, especially in cats, steroids, and Cushing's disease. Signs include increased thirst, increased urination, increased appetite, and weight loss. A low glucose value is called hypoglycemia, and causes would include not eating, especially in small puppies and kittens, insulin overdose in diabetics, severe illness or sepsis, liver failure, or something called an insulinoma, which is a neuroendocrine tumor that secretes excess insulin. Signs of hypoglycemia include weakness, tremors, seizures, or even collapse. A glucose value is just a spot check, where it is at that moment. So if we have concern for something like diabetes, we may want to check a fructosamine. Fructosamine gives us an average blood glucose over 2 to 3 weeks and helps us tell the difference between true diabetes versus a temporary stress spike. There is one small caveat to fructosamine. Fructosamine depends on proteins, so if the albumin levels are low, you might get a falsely low fructosamine. And that is all I have time for this video, so let me know if you have any questions or suggestions on what else you want me to cover. Love you guys, bye. Welcome back. This is part 67 of things that your vet staff wishes you knew, and we are still covering blood work right now. This is part 8 of blood work, and if you have not watched the previous 7 parts, I recommend you go do that because I'm building off of each video. The good news is that we have a light at the end of the tunnel. I am almost finished with blood work. It's like this video and maybe one more. For this video, we're going to focus on protein values. There are 2 main proteins in the blood that we will look at for pets, and those are albumin and globulin, and together they would make up your total protein value. Proteins help maintain fluid balance, transport nutrients, and can give us insight into liver function, kidney function, and inflammation. A high total protein is called hyperproteinemia, and causes can include dehydration, which is often the most common, chronic inflammation, infection, and certain cancers such as multiple myeloma. And oftentimes we're not going to see signs from just high protein in the blood by itself. If we see signs, it's probably because of an underlying cause. A low total protein is called hypoproteinemia. Causes could include liver disease because they're not producing proteins, kidney loss because they're losing proteins in the urine, GI loss such as in PLE, malnutrition, and severe illness. Signs would look like weakness, weight loss, and fluid buildup. Albumin is a vital protein produced in the liver that maintains blood volume, transports substances, and prevents fluid leakage from blood vessels into tissues. It is crucial for stabilizing blood pressure, preventing abdominal swelling, and edema. High albumin is called hyperalbuminemia, and if it's high, it's usually always caused by dehydration. Low albumin is called hypoalbuminemia. Causes would include liver disease, kidney disease, GI disease, or severe burns and wounds. Signs include edema or swelling, ascites, which is fluid in the abdomen, or pleural effusion, fluid in the chest. Globulins are blood proteins produced by the liver and immune system that play a crucial role in immune response, fighting infections, transporting nutrients, and assisting with blood clotting. High globulin is called hyperglobulinemia, and causes include chronic inflammation, infection, immune diseases, and some cancers such as plasma cell tumors. Low globulin is called hypoglobulinemia. Causes would include immune deficiencies, puppies and kittens that don't get colostrum, and protein loss. And the main sign of this is going to be increased susceptibility to infections. Protein values are a great example as to why we don't look at just one value on blood panels for an answer. For example, if we saw just a low albumin, we might be thinking kidney or GI loss. But if we saw low albumin and low globulin, we might be thinking severe protein loss or liver failure. But that's all I have time for this video, so let me know if you have any questions or suggestions on what else you want me to cover. Love you guys, bye. Welcome back. This is part 68 of things that your vet staff wishes you knew, and we are still covering blood work, but this is the last video. We are finally done. This is part 9 of blood work, and if you have not watched the previous 8 parts, I do recommend you go do that because I've built off of each video. This video is going to discuss more of the behind the scenes of blood work, including which veins we use, in-house versus send-out blood work, and then why sometimes we have to come back and tell you, hey, we need to draw it again, or we couldn't get anything at all. The most preferred vein for us to use in a blood draw for both cats and dogs, if we need full tubes of blood, is the jugular, and yes, I do mean the one in the neck. There are going to be some instances where the jugular is not an option for us, so if your pet is extremely wiggly or they're thrashing around and trying to bite us, a neck is not an option. We don't want to puncture anything we're not supposed to while we're in there, so we really do need them to sit still for it. If a jugular isn't an option, the next 2 veins we're probably going to look at is a cephalic, which is in the front leg, or a saphenous, which is in the back leg. If a jugular can't be done on a cat, sometimes the most preferred after that would be the medial saphenous. So we would have them on their side, and that vein is on the inner portion of their back legs. Ideally, we would like to get full tubes of blood from the first poke and not have to poke them multiple times. But it's not a perfect world. That doesn't always happen. Sometimes they're super wiggly, sometimes the vein blows and we can't use that vein anymore, so then we have to end up poking again. Now we're going to talk about in-house blood work versus send-out. So in-house is what it sounds like. We do it in the clinic and we get the results that day. And send-out, we would send out to a clinical lab to have them run it and usually get it back within a day or a couple of days, depending on the test. Usually, in-house blood work is going to be more expensive than sending it out. So a lot of clients, if it's not something emergent, will opt to send it out for the cost. Sometimes in-house blood work is a little bit more limited as to which test we can actually run, because we don't have all of the same equipment and reagents and everything that a clinical lab would. So there are certain tests that we don't carry in-house, and the only option is to send it out. Now let's talk about some of the reasons we might struggle to get the blood in the first place. That could be dehydration, low blood pressure or very sick pets, super small veins such as in puppies and kittens, really thick fur, obesity, or maybe they are just super wiggly because it really only takes small movements for us to miss. And one more quick point before I wrap this up. Everything that I have covered about blood work really only scratches the surface, and it does not replace you talking to your vet about blood work. All it does is give you a better understanding for when they do talk to you about it. I'm out of time. Let me know if you have any questions or suggestions. Love you guys. Bye. Welcome back. This is part 69 of things that your vet staff wishes you knew. And for this video, we're going to cover the English Mastiff and things you should know if you have one or plan on getting one. As usual, we're going to start with a picture and talking about coat types and colors. They all come with a short, dense coat and have that signature black mask, but they can come in fawn, apricot, and brindle. Mastiff type dogs go back thousands of years, like well into BC years. The modern Mastiff we know today, though, was developed later in England, but the roots are still very old. This is a massive dog with a relatively short lifespan. They can be anywhere from 120 to 200 plus pounds, and they live on average 6 to 10 years. They were bred to be used as war dogs, guardians, and protectors, and oftentimes are known for being gentle giants. In general, they are extremely loyal and bonded to their family, naturally protective, typically calm, low to moderate energy, and not super playful compared to other breeds. But this breed is not ideal for first-time pet owners. Because of their size and their guarding instinct, they need to be properly socialized, and they can also be pretty stubborn. It is very important that these dogs get large or giant breed puppy diets while they are still young, because improper nutrition is going to increase the likelihood that they are going to have joint issues. Now let's talk about some of the most common health conditions that this breed is prone to. This breed can be prone to a number of orthopedic issues, including early onset arthritis, which I covered back in part 29, hip dysplasia, which I covered back in part 31, CCL tears, which I covered back in part 33, and elbow dysplasia, which I plan to make a future video on. They can be prone to heart disease, especially DCM, dilated cardiomyopathy, which can be silent until the disease is very advanced. Because they are large and somewhat deep-chested, this breed is prone to bloat, or GDV, gastric dilatation volvulus. That is when the stomach flips on itself, cutting off blood supply to the rest of the GI tract. This is an emergency when this happens, and some owners will actually opt to do a gastropexy, a preventative surgery to tack the stomach in place to try and prevent GDV. This breed can be more prone to heat intolerance, and that means that you should keep a closer eye on them on really hot days where they're super active to try and prevent any chance of heat stroke. Because they have lots of folds on their face, they can be more prone to having skin irritation and skin infections inside those folds, so you do have to keep those clean. Overall, they're a really great breed, where most of the time the most aggressive thing about them is their slobber. But that's all I have time for, so let me know if you have any questions or suggestions on what else you want me to cover. Love you guys, bye. Welcome back. This is part 70 of things that your vet staff wishes you knew, and for this video we're going to talk about pugs and things you should know if you have one or plan on getting one. As usual, we're going to start with a picture and talking about coat colors and types. So pugs have a short, smooth double coat, and they will shed a lot. And they primarily come in two recognized coat colors, solid black and fawn, with the classic black mask like the one in the picture. Pugs were bred in ancient China over 2,000 years ago, and they were bred to be companion dogs for Chinese royalty. But they didn't always look quite like they do today. They actually used to have a longer snout that over time gradually was selectively bred for to have the shorter, smushed face. And that has grown exponentially over the past 150 to 200 years. On average, they live around 12 to 15 years, and they tend to be extremely affectionate, people-oriented, a little silly, a little stubborn, very food-motivated, and usually good with kids and other pets. Now let's talk about all the major health concerns that this breed is prone to. First and foremost, we need to talk about the fact that this is a brachycephalic breed. Their face is smushed, they still have all of the same anatomy that a typical dog would, so it is harder for them to breathe. A lot of brachycephalic breeds will struggle with noisy breathing, snorting, snoring, wheezing, chronic heavy panting, labored breathing, exercise and heat intolerance, and it's why you need to keep a closer eye on them when they're panting really heavily, when they're super active, when it's hot outside, because they are more at risk. You can check their gum color, and as long as it's still bright and pink, they're doing okay, they're getting enough oxygen, but you also need to be concerned about heat stroke for them. They can be prone to a lot of eye issues, including eye ulcers, dry eye, pigmentary keratitis, and something called proptosis, where the eye literally pops out during trauma. They're more prone to having allergies and skin fold dermatitis, so you do have to clean those folds on their face. They tend to be very food motivated, so you do have to keep an eye on their weight. They are more prone to obesity. Pugs are more prone to dental disease, which I covered back in part 15, and luxating patella, which I covered back in part 32. And the last major health concern I want to cover is something called pug-dog encephalitis. It is a necrotizing meningoencephalitis. And what that word means is it causes inflammation of the brain and its surrounding tissues with actual destruction or necrosis of brain tissue. It's considered an autoimmune disorder because the immune system is mistakenly attacking the brain, and it's most common in young adult pugs anywhere from 6 months to 3 years of age, and more often seen in females. There is a heavy genetic component here. And honestly, I think pug-dog encephalitis deserves its own video, so I will probably cover that in the future. That's it for this video. Let me know if you have any questions or suggestions on what else you want me to cover. Love you guys, bye.